hasn't suffered with some type of ankle sprain, whether it be running outside, maybe you're performing a lifting move at the gym or attending an aerobics class or high impact class, or maybe you just happen to fall down the stairs like I recently did. Well, there are some simple basic things that you can do at home to help you kind of recover from that ankle sprain and get you back to that activity that you love most.
It's about getting to the root problem.
Hey everyone, it's Dr. Heather here, and like I said, I want to talk to you guys about ankle sprains. Now, if you've seen a couple of my videos here on the channel, I talk about various exercises you can do to help you if you have weak ankles that may be leading to Achilles tendonitis or maybe even some of those dreaded shin splints, whether they're anterior or posterior. But what I'm primarily talking about is when we sprain that ankle and we really have gone ahead and allowed for that foot to roll under us. And what I mean by that is that when you step down on the ground, you feel the foot kind of cave in and you collapse and you fall right on your side. And you're noticing that you're getting more discomfort, pressure on the outside of the ankle, which is the more common area to have an ankle sprain. Now, the reason why we usually see ankle sprains more on the outside of the ankle is simply because of those little ligaments that attach our fibula and our tibia to the actual ankle itself, meaning the talus bone and the calcaneus. Those are some of your major ankle bones. Now, these little ligaments don't have much supporting it, versus if we were to look at an ankle sprain on the inside of the ankle, you'll notice that from the diagram that the ligament looks a lot thicker, a lot stronger, because it's all joined together versus being separated out like it is on the outside of the ankle. Now, again, an ankle sprain could be many degrees, meaning you could have a type 1, a type 2, or a type 3. Depending on the severity of that ankle sprain will also determine how quick you can get back to recovery. Now, for purposes of this video, we're primarily talking about a type 1, type 2 ankle sprain, where we can use what I'm going to give you today to really kind of get back to recovery within that 4 to 6 week time frame. Now listen, if you're still noticing a lot of swelling, a lot of discomfort around that ankle, I would always recommend go get an x-ray just to rule out a fracture, because we never want to go ahead and start returning to activity and make a injury worse, because that would be just a big no. So like I said, I'm going to give you guys really my go-to recipe when it comes to ankle sprains, and again, this is for type 1, type 2. Now, the first thing you're going to want to do when the ankle sprain initially sets in is you're going to want to grab the ice. Now, if you've caught my video on how to make an ice cup, you're going to go ahead and use that, because we're going to do an ice cup massage. It is one of the more effective ways to kind of treat that initial injury. But if you don't have a ice cup to go ahead and create, then you could simply just take that ice pack and wrap it around the ankle and go ahead and elevate the foot higher than your heart rate. What do I mean by that? Well, lay down on the ground, put that leg right up on the couch or a chair, and allow for the swelling to start to come down. Now again, remember there are different degrees of the ice that you want to feel, meaning you're gonna feel initially some achiness, some pain, some discomfort, then you're gonna feel the burning, and then you're gonna feel the numbness. That really is an indication that the ice is getting to the area and starting to help the healing process. Now, again, if you are having some severe swelling, you may need to take an anti-inflammatory. But again, check with your physician on that, because again, if you are taking any other types of medication that are not warranted to take with an anti-inflammatory, you do want to double check with your doctor on that. So again, first step is get the ice on that ankle. That's essential from the instant it happens for that 72-hour period. Now, the next things we're going to want to do is actually start doing some foot pumping. And what do I mean by that? Well, you're going to lay back with that foot nice and elevated, and you're going to go ahead and flex the toes towards you and then push the foot back. You don't really want to do this rapidly, but you want to keep up a good pace, where essentially you're just flexing the foot and pointing away, flexing the foot and pointing away. Now, if you are someone who is using an ice pack, you could do the foot pumping with the ice pack on. Now, the next thing you're going to want to do is start to go ahead and do some soft tissue work to that ankle. Now, granted, if you do have a friend, partner, or spouse that's willing to do a little bit of massage work around the ankle, please go ahead and have them help you here a little bit, because sometimes it is tricky to kind of massage out our own limbs. Now, I highly recommend using some BioFreeze Icy Hot or Tiger Balm to the area, because what that's going to do is, as you rub it in, again, it's going to help in decreasing the inflammation around the area. And what you want to do is go ahead, do some nice long strokes along the lower limb, really kind of touching upon the calf, the perineals, and then what we're going to do is do some nice quick cross friction massage all along those little ligaments that I mentioned earlier in this video. That's going to really help break down the scar tissue and make sure that the ligaments realign themselves during the healing process, making your ankle a lot stronger and heading off a potential sprain later on. Now, the next thing from there is you're going to want to start doing some heel and toe walks. That's usually going to happen probably around day 3, day 4, where you're going to start to walk across the room on your toes and then come back on the heels. Again, starting to work the calf and the tibialis anterior a lot more to help strengthen the ankle in totality. Now, from here, you can go ahead and do some simple ABCs of the alphabet with the foot. And what you would do is just draw the alphabet out with the whole foot. So going ahead, making an A, making a B, making a C, allowing for the ankle itself to kind of regain joint mobility. Now again, these are all the steps that I would utilize when treating an ankle sprain. And if you go down to the description, I've left it there for you, pretty much bullet pointed out exactly how you're going to go about using everything I just described in this video. Again, this is something you would want to initially do for that first 7 to 10 days. And then from there, as long as the swelling and pain has decreased, you can start to go back and resume activity. Now granted, you may need some support around that ankle while it's still getting its healing on, where you could just use a nice simple ACE bandage, a supportive brace, which they sell at all major drugstores. But if you have questions about what type of support would benefit you, drop those comments down below. Like always, everyone, if you found this video helpful on ankle sprains, give it a like. And don't forget to subscribe to the channel today for more great videos around how to fix your pain naturally. Alright everyone, I'm Dr. Heather, your virtual sports chiropractor. I'll catch you in the next video.